We love how everything's done here and you don't have to send any labs off or sperm off or anything. Even after a retrieval, you get to recover here, which is amazing. So tell me a little bit more about that.
So that's what we wanted to do, was to make a place where everything's easy, where we take you by the hand and guide you through the entire process. And because the laboratory's here, the procedure room's here, it really allows us to accommodate everybody's schedule and make sure that they have a very easy path through their fertility journey. Having the test results or the endocrine results available right away, we can immediately adjust the dosage of medication. And since we have a lot of patients from outside of the area, what we want to do is prepare their medications in single-use syringes so they don't have to dial a pen or mix the medication themselves to avoid errors. That way they can go grab lunch, come back, and the medication's ready for them for the next few days. When they come back, we repeat that procedure. The other part that I think is all-inclusive is, as you mentioned, as we get older, we may need to use an egg donor. So we have both egg donor agency and an egg bank as a part of the clinic. And with that, we can guarantee that we get a PGTA-tested normal embryo, or we even offer guaranteed live birth packages where we keep going until there's a live birth. And then the last part to the one-stop shop kind of thing is surrogacy. So we also have an in-house surrogacy program. So in those rare cases when somebody doesn't want to carry or can't carry, then we can incorporate that into the treatment plan without any issues.
What made you want to go into this field or just become an REI?
My grandfather and father were both physicians, so even though I tried to go into business when I was in college, I had a natural draw towards medicine. And my father was a family physician, so it was very nice to be able to see how patients came back to him, and he was a part of their family in many ways. And I wanted to have that type of continuity, have a positive influence. And gosh, it sounds kind of morbid. I think in many ways, like, cardiologists keep you from death versus helping you create life. And this seemed like a really nice, creative medical path to be in, and to really get to know your patients and be a part of their life in a positive way.
Yeah, and you kind of touched on my next comment. I was going to ask what your favorite part about your job was.
I think it's the patients, right?
Yeah.
It's a community that's created. And that really is very nurturing to all of us here.
Yeah, absolutely. And I'm looking on your wall and I'm seeing all your different degrees, but what is your background and how long have you been doing that?
Sure. So I did my medical training at Emory University, and I stayed there for my residency in obstetrics and gynecology. Then I came to Los Angeles to do a fellowship in reproductive endocrinology and infertility at UCLA and Cedars-Sinai Medical Center, so it's a combined fellowship. Then I started in private practice in 2005, and in 2016 we started this clinic, so we just had our 9th anniversary.
Okay, that's wonderful. And you're the only doctor at this clinic, and you started it here?
Yes. So
that's wonderful.
Yeah, no, it's been really just an amazing experience. We started this clinic with the idea of Project Aristotle. It's a research done by Google on what makes groups work. We really wanted to create a positive environment for the patients and for the staff, that when you're coming to work, you're happy coming here. When you're here, you're happy. And I think it made really a huge difference in my life. I'm excited to come to work on Monday mornings.
That's amazing. I'm in my early 40s, and in my group, I'm starting to see a trend of older women that are starting to pursue IVF, first trying with their own eggs. We all know that it's really difficult as you age because your eggs become lesser and lesser as we age. I think they call it like a geriatric pregnancy after a certain age.
No, I think that's an unfair term. I think that's a very misogynistic term.
It is. And I hate that term. But yes, we're starting to see older women pursue IVF. If a woman in her 40s or 50s that's maybe perimenopausal or menopausal is just starting out on this journey, what kind of advice would you give them, or how would you go about seeing a patient like that?
I think the difference between like early 40s and mid 40s or late 40s is very, very different. Early 40s, a lot of people are successful with their own eggs, but mid to late 40s, it's very difficult.
Yeah.
I would encourage, especially for those in the mid to late 40s, to consider going through therapy concurrently with the IVF treatment. The emotional turmoil that we go through when we're going through fertility treatment, we pack in our subconscious and it comes up in really bad ways. And the more we can be self-aware about what we're going through, the easier it is to go through it, the more resilient we are, and therefore the more successful we will be.
That's great advice. Well, I definitely feel like a calmness vibe here. It's really comfortable. Everything's a one-stop shop and it's amazing here. So if you get a chance, definitely check them out.